very exciting areas that we have just recently gotten into is a theory about depression that we've known about theoretically for years. And that is that there was always some data out there that suggested low levels of folic acid in the brain may be associated with depression, dementia, and possibly even some cardiovascular diseases. One of the things that has recently shown up is that there may be a group of people who are genetically unable to take folic acid or folate in our dietary sources and supplements and turn it into the form called methylfolate that gets into the brain. We require methylfolate to get through what's called the blood-brain barrier. Methylfolate is required for the brain to make serotonin, norepinephrine, and dopamine. And so if you don't have methylfolate or you don't have enough methylfolate, one cannot adequately synthesize or make the important neurotransmitters that may play a role in depression. And so there are treatments that actually involve pure methylfolate. One of them is basically now approved as a medical food to be used as an add-on treatment for someone, for example, who's on an antidepressant and still has symptoms of depression. So clinicians may have to decide who's a good candidate for someone to receive methylfolate as an add-on treatment for their depression. Well, if the individual has a family history of depression, maybe they have other illnesses, such as family histories of dementia, strong family history of cardiovascular disease. There may be something there without having to do genetic testing. Because we know that individuals who have this form of a genetic, what we call a genetic polymorphism, may be 6 times more likely not to respond to an antidepressant or achieve remission relative to those who don't have this genetic abnormality. We know that you could look at serum blood folate levels, but blood folic acid or folate levels really don't tell you much about what is actually getting into the brain. You could look at something called red blood cell folic acid levels. That probably mimics best what happens between the blood and the blood-brain barrier, but we're actually doing a study now to ascertain whether or not that truly is sensitive enough of a test. So currently, it may be that we just give the trial of folic acid and see how the individual does on that augmentation. One of the first medical foods that got approved in this country is L-methylfolate, a pure form of methylfolic acid that gets through the blood-brain barrier. And interestingly, its approval is for an add-on treatment for major depressive disorder. It is also approved for dementia, diabetic peripheral neuropathic pain, many of the same kind of diseases that we know involve the neurotransmitters that are also involved in depression.